Good afternoon, Excellencies, distinguished panelists, ladies and gentlemen. Welcome and thank you for making the time to be here today for the Asia launch of our new IFRC report on law and public health emergency preparedness and response, lessons from the COVID-19 pandemic over the last year and a half. And here in Asia, we're all still in a critical phase of the response. And so we truly are a Caspelian. I'll be moderating the first part of this event. Before I proceed, may I remind everyone of our usual housekeeping rules. Please keep your microphones muted while our speakers are presenting. For questions or comments, we encourage everyone to use the Q&A box at the bottom of your Zoom screen, or ask your questions by raising your hands later during the live Q&A session after our panel discussion. We encourage all of you to introduce yourselves, your organizations, and where you're from through our chat box. Finally, this event will be recorded and will be uploaded to the IFRC Disaster Law website. In the first part of this event, we will have the presentation of highlights and key recommendations from the IFRC report. We will then hear from our technical partners who will provide us with an overview of the context and relevance of the report in relation to the work that they do in the region. In the second half, our esteemed panelists will then share best practices and lessons that they've learned from the COVID-19 response from across Asia. So without further ado, let me give the floor to Ms. Catherine Clarkson, head of the IFRC Country Cluster Delegation for Thailand, Cambodia, Laos, and Vietnam, for some opening remarks. She will then be followed by Ms. Gabby Emery, Asia Pacific Disaster Law Manager at IFRC and the main organizer of this event. She will provide an overview of the report, its recommendations, and relevance for the region. Catherine, the floor is yours.
Thank you, Pauline. And good morning, good afternoon, and good evening, ladies and gentlemen and colleagues. Welcome, and thank you very much for joining us here today at the Asia launch of IFRC's new report, Law and Public Health Emergency Preparedness and Response, Lessons from COVID-19. While no one has been spared from the effects of COVID-19, the consequences of this pandemic have not been equally felt. The crisis has been defined by profound and persistent inequalities, both in terms of who is most at risk and how the world has responded. We may not have known back in January 2020 the full extent of what was to come, but we certainly knew that a pandemic of this size was only a matter of time and we could have been better prepared. If COVID-19 has taught us anything, it's the importance of being ready. Central to being ready is the role of law and policy in combating public health emergencies and in protecting communities in an equitable way. Legal and policy instruments have underpinned the COVID-19 response, from unprecedented restrictions on freedom of movement to expedited vaccine approval. However, levels of success in using legal and policy instruments to respond to the pandemic have varied widely. In some cases, existing laws and policies have proven to be outdated or inadequate by more than a century. In other cases, tried and tested systems that have been established for responses to natural hazards were not capitalised on or sidelined during the pandemic response. Restrictions introduced to curb the spread of COVID-19 have also prevented many humanitarian actors, including National Red Cross and Red Crescent societies, to fulfil their humanitarian mandate as first responders to disasters and emergencies and in providing community-based health and social care to vulnerable populations. For over 20 years, the IFRC network has been providing advice and support on how to develop and implement effective disaster laws. In this new report, IFRC analyses the role of law and policy in supporting preparedness and response to public health emergencies, including how to ensure greater coherence with other domestic systems, for example, in disaster risk management. The findings of the report indicate that urgent action is needed to strengthen domestic laws and policies for public health emergencies and disasters. We're confident that this report and its accompanying guidance will provide a valuable resource for governments embarking on reviewing and strengthening their legal frameworks, and we stand ready to assist. I want to take this opportunity to thank our key regional partners like the Australian Department of Foreign Affairs and Trade, Australian Red Cross, and the German Federal Ministry for Economic Cooperation for their generous support to this research and our wider disaster law work in the region. I would also like to acknowledge the ongoing partnership with academic networks across the region, pro bono legal partners such as Allen's Law Firms and White & Case, as well as the United Nations systems, namely UNDRR, WHO, UNDP and UNESCAP in this work. In a short while, our distinguished panel will be presenting best legal practices and lessons from Asia in the management of COVID-19 pandemic and innovative solutions and initiatives that will guide us all to build legal preparedness capacity and be better prepared for future public health emergencies. We have a real opportunity to review our laws and systems to ensure they're more resilient to any type of emergency, whether it's health, climate, or natural hazard related. But we must act now to save lives and so we are not caught off guard again. Thank you.
And greetings, everyone. Thanks so much for joining this webinar. My name is Gabby Emery, and I'm the Disaster Law Manager for Asia Pacific with IFRC. And I'm going to be giving a very quick, brief presentation on the main findings and recommendations of this research and its relevance for this region, for Asia. So I would ask Padmini if she could put the presentation up. Wonderful. So as you've heard, Red Cross and Red Crescent have been supporting governments and working alongside our partners to strengthen development and implementation of disaster laws in Asia Pacific for over 20 years. And over this time, we have seen many common regulatory issues arise in response to all types of hazards, be they health, climate, or natural hazard in origin. We know firsthand the importance of good legal preparedness. Laws lay the foundation for good risk management. They help to clarify roles and responsibilities, who should be doing what and when. They allocate state funding and they provide really important accountability mechanisms between governments and their community. Used effectively, laws can also be a key tool to prevent hazards from becoming disasters in the first place. However, the experience of COVID-19 has shown that many countries were not legally prepared for a major public health emergency. When COVID-19 emerged, old laws, policies, and contingency plans had to be dusted off. Some proved to be outdated or inadequate. In fact, never before have we seen so many laws produced for one such event. So in the middle of last year, IFRC Disaster Law started to look at this issue in more depth. Our aim was to understand what was really happening in terms of these legislative developments and whether there were lessons that could already start being learned from this response, which could bolster our preparedness for future public health emergencies. And for us, we really wanted to look at how we could better maximize and ensure better synergies with pre-existing disaster risk management systems as well. So our research looked at the relevant international frameworks and commitments, namely looking at the WHO international health regulations. We also looked at relevant health provisions of the Sendai framework for DRR, namely the Bangkok principles. We looked at any regional commitments that might be made under regional mechanisms. And we also analysed 120 emergency declarations that were enacted at the beginning of the pandemic, as well as looking at an in-depth look at 30 country case studies, many of which were from here in Asia Pacific. So as I go to the next slide, so what we really found, what was the current state of play in terms of the institutional framework. So if we could just jump to the next slide, please, Padmini. So we found that public health emergencies had really been, or biological hazards were very much defined as a disaster, both, sorry, if we could just go back to the middle slide. Thank you. To the slide before would be great. Okay, great. Yeah, stop at that one. So yeah, we found that public health emergencies are defined as a disaster and, you know, international frameworks and in most domestic laws and policies and under DRM laws, they actually provide for public health emergencies as a disaster. However, predominantly, most countries still had a separate regulatory mechanism in place for public health emergencies, separating it from kind of normal natural hazard responses. So the research found that broadly there was three categorizations of how countries have, set up their frameworks for public health emergencies. On one side, you see public health emergency dominant frameworks. So as their name suggests, largely driven under public health legislation under health ministries. And on the other side there, you have DRM dominant frameworks, which were the response largely driven under disaster risk management models with public health measures well integrated into that. But the majority, and by far the majority here in this region, were hybrid models. So you had public health emergency framework, but you saw DRM laws and policies and plans also playing a very critical role, particularly in the areas of coordination and states of emergency. But what we found was that there was an overall kind of lack of clear rules of the road for how these systems should really work together in a coherent way. Often there was some confusion, there was some duplication, there was some power struggles between the different actors. And often we found that those pre-existing, this region especially with our experience in natural hazard response, weren't really capitalized on. We also found that many of the good practices and evolutions of DRR in terms of multi-hazard responses, in terms of multi-stakeholder responses, community participation hadn't really evolved yet into public health emergency governance. So while we're not advocating that one approach is better than another approach, what we certainly see is that there is definitely room for greater coherence and to build off synergies into what already working well in the countries as we look to build back also our laws and policies better back from COVID-19 as well. So moving to the last slide now, the third slide, we also have other recommendations that we find in this report as well. So one big area that we found is that a lot of the public health legislation that we currently have globally and in Asia is very, very old. So actually many of the laws we examined were over 100 years old. This was particularly true in South Asia region and while we look at Asia. And we found that a lot of the legislation only referred to specific types of diseases, so lacked the flexibility to respond to new and emerging challenges. It often didn't lacked kind of modern approaches to the all of society public health risk management approach that's needed. So certainly a strong recommendation to review, to update those laws, and while you're doing that as well, to make sure that those synergies with disaster laws are also maximized. In terms of implementation, we saw very limited implementation of key international commitments around the international health regulations or the Bangkok principles of the Sendai framework being drawn down into domestic laws and policies. So again, a strong call for implementation of those international commitments, but also a very strong call for implementation of those national frameworks into the subnational context and at the community level. So ensuring that everyone's aware that they exist and know and understand their rights, roles and responsibilities therein. The other area you see there is around reactive approaches. So a lot of the public health emergency legislation was a very response-driven model that didn't prioritize or incentivize risk reduction approaches. And certainly we found that there was a lack of a duty of public health authorities to give clear and actionable early warnings. So we found this was a very critical omission as well. So I think anyone in the DRR field would know, I think that evolution around DRR planning, moving from kind of that reactive response-driven model to one that prioritizes risk reduction. I think, there's a lot of learnings there within that DRR sector domestically, and it's just a matter of bridging that connection around public health emergencies as well. Coherence, I talked about earlier, so I won't repeat myself. So participation, so we have seen during COVID-19 that every sector of government, every sector of society has been impacted by this pandemic. And it's really important that we take an all of society, all of government approach into future planning for public health emergencies and pandemics as well, just like we do now for other types of hazard events. So that's really important that that is included in our governance thinking. Coordination. So coordination is the perennial problem really, and a very common regulatory issue that we see in all types of responses. It's really important that laws clearly articulate roles and responsibilities of the different actors in the different phases of the risk management cycle. It's also really important that the law is quite clear on how that coordination needs to work, and particularly from national to subnational level. I talked about before that a lot of the coordination mechanisms for public health emergencies actually fell under the mandate of the DRM system. So we saw a lot of national disaster councils activated. We saw a lot of disaster controllers appointed, but there seemed to be a lack of clarity sometimes on how those mechanisms work for a public health emergency. So I think although we have the mechanisms in place, we certainly need more detail on how they needed to work when a biological hazard is the primary hazard. We also saw different coordination challenges, being that, health ministries are normally very large, they're quite decentralized. So how that internal coordination worked and how that also then needed to work and coordinate externally also caused issues. Humanitarian access. We know in responding to other natural hazards, it's really important that humanitarian responders like National Red Cross and Red Crescent societies are exempted and they have the necessary legal facilities to be able to do their work. Unfortunately, we saw many regulatory issues hamper the access of many humanitarian providers, so they weren't able to do their work as effectively. So looking forward again, we need to look at our preparedness to make sure that our key humanitarian actors and partners can also work in times of public health emergencies, subject of course to health safeguards. And of course, really importantly, protection and inclusion. Our laws shouldn't just be there to set up systems and roles and responsibilities, but it also really needs to be thinking about people and how to protect and include those most at risk from any type of disaster or emergency as well. So in that planning, the specific needs need to be catered for and clear roles and responsibilities allocated across government and non-government for how those needs need to be met. So there are many more recommendations in our research, and I very much encourage you to take a look at the research. It's on the website. There's a link also up in the chat box, and we'll be looking through some of those issues in our panel discussion later. So thank you very much for bearing with me through the presentation. We will now play a very short video, and I will hand back to Pauline. Thank you so much.
Thank you very much, Catherine and Gabby, for your insightful opening remarks. As we've heard from their statements and the presentation, it's very important to look at how the laws and regulations governing public health emergencies focus on the needs of the most vulnerable groups, as well as focusing on the preparedness aspects of this pandemic. And this is the importance that has been emphasized in our report, and which will be shared later on by our technical partners. We would now like to invite our technical partners from the UNDRR and WHO in Asia to provide some reflections on the context and relevance of this research for their work in the region. I am pleased to invite Mr. Marco Toscano Rivalta, who is the Chief of the Regional Office for Asia and the Pacific of the United Nations Office for DRR, or UNDRR. Marco was previously the Chief of the UNDRR Liaison Office in New York, where he supported the drafting and negotiations of the Sendai Framework for Disaster Risk Reduction. In addition, Marco has been very much involved with the United Nations International Law Commission in the development of the draft treaty on the protection of persons in the event of disasters. We will then invite Mr. Bennelly, who is the Technical Officer for Legislation and Regulation for the World Health Organization in the Western Pacific. His work focuses on supporting WHO's member states to strengthen their legal frameworks for health across a range of areas, including public health, health emergencies, and health systems and services. May I now invite Marco to give us his remarks. Marco, the floor is yours.
Thank you very much, Pauline, for your kind introduction. Colleagues online, good morning, good afternoon to all of you. It's really a great pleasure for me to be here with you today at the launch of this important report. And I would really like to congratulate the IFRC for the report and also for keeping us really on track over the years on all these important points. We know that legislative reforms take years and takes a lot of perseverance. So this really continued focus and reminders of the most important issues is really of great help to all of us. We definitely fully endorse the report's finding and its central message that fundamentally legal frameworks for public health emergencies need to be strengthened and better integrated with disaster risk management frameworks. As also Ms. Emery was saying, this is not only in keeping with the Sendai framework for DRR, and actually I would like to recall that if we have such strong provisions, health provisions in the Sendai framework, is because the negotiations took place at the time where Ebola was strongly hitting countries. So there was a conscious choice of making these strong connections between disaster risk reduction and health. And then also was thanks to the leadership of Thailand that then subsequently the Bangkok principles were adopted. So this report and this core message is really in line with the Sendai framework and also with the Bangkok principles. And I would really offer, let's say, 5 recommendations for considerations on how governments and stakeholders can take advantage of this report. The first one is that countries really need to adopt multi-hazard approaches to ensure comprehensive risk management. Now, key to this is ensuring that all relevant sectors and institutions are active participants in national and local disaster risk governance systems, and that health security and disaster risk management arrangements enable, and I underscore, a whole of state institutions at the central and local level, as well as a whole of society approach. In our analysis last year of the Asia Pacific, the risk governance mechanisms in the Asia Pacific response, we noted that a number of ad hoc decision-making bodies were set up. Now, in a way, this is good and is interesting, as also Ms. Emery was hinting in her presentation. And it was quite interesting to see that many of these bodies were really answerable at the most senior level of government. And why this is good is because in the RR, often has been called for the coordination and the guidance from the top, really from the top level. And we really hope that these ad hoc mechanisms actually can be further institutionalized so that they are no longer ad hoc in case we face, and likely we will face, further disasters. And I would say that this is very much in line also with priority 4 of the Sendai framework, which is really not only about preparedness and response and building back better, but it's about preparing to build back better. And therefore, the work that the IFRC have been doing through this, through the IDRL work and the funds of this report is really pointing us to this word of prepare to build back better. So the institutionalization of these mechanisms is really key to that aim. And then also would certainly strengthen the, what is being called the adaptive risk governance, so that our mechanisms are really able to, to stay updated with the needs of real life. My second recommendation is that, which is connected to the first one, is that countries really need to assess multidimensional vulnerabilities of the interconnected systems in order to better plan and anticipate. And this goes in hands with the fact that risk is compounded now, and disasters are really complex in their manifestations. And that, as I was hinting earlier, does require a systemic approach to disaster risk management. And we have seen numerous examples in the Pacific where countries have to grapple with the pandemic, with drought, and with cyclones. So I think we have plenty of evidence of that. And which points to another fundamental point, is that we really can no longer plan ourselves around hazard by hazard. Hence, again, the point of systemic risk. And we really need to have legislations in place to guide us as citizens, us as institutions, us as civil society organizations and stakeholders to play along these lines. My third recommendation is connected to the need to prepare to plan against the cascading impact of disasters, and this is beyond their immediate impacts. We know that the impact of the pandemic is extraordinary, and we probably are not able to fully grasp the long-term socioeconomic impact that is going to have on our societies, systems, and communities. But certainly, what we do know is that there is a major, strong impact on the most vulnerable sectors of our societies. The poor, the migrants, the informal workers, older persons, and so on and so forth. And we know that we must leave no anyone behind. And therefore, this work again is fundamental. That the normative frameworks are essential to that, and therefore also to link with the social protection mechanisms that we can use for prevention. This leads me to a fourth point, which is about inclusivity. And it is really essential that legal framework address any form of direct, indirect, unintended exclusion, because we do know that exclusion leads to vulnerability, which in turn leads to increases basically disaster risk for individuals and groups. And in this connection, I really would like to underscore the important synergy that exists and needs to be further harnessed and capitalized between disaster risk reduction and human rights and the human rights instruments. My last recommendation is really for the new legal instruments to really guide us and institute a culture of prevention. That has been really central to the work of DRR over the decades. It was stressed once and again in the Sendai framework. And these cultural preventions need to be adopted across all systems, sectors, budget and plans. So it is really certainly a challenging work, but that's precisely why we need legislations to guide us step by step. So really a prevention first approach is of essence, where then hazards, be they biological or meteorological, and vulnerabilities are identified and then mitigate early on in order to avoid the creation of new risk and prevent basically disasters and emergencies in the first place. And it's really necessary to redouble our efforts towards preventions to break the vicious cycle that takes us from disasters to disasters. In conclusion, I would really like to congratulate the IFRC disaster law team. Thank you for all your work over the years, and of course also thanks for to the IFRC for being a great partner to us. Certainly we can all benefit from this. Countries can benefit to strengthen the domestic normative frameworks, but also in terms of strengthening the instruments that allows countries to cooperate. So always looking at this dual phase of legal instrument for domestic work, but also for enhanced international cooperation, because DRR is fundamentally based on international cooperation, let alone goodwill. So thank you for this, again, for having us here.
Thank you so much, Marco, for your remarks. And I really echo your statement about cascading, the importance of assessing cascading risks, as well as the need to have a culture of prevention. And now I would like to turn over the floor to Mr. Bennelly of the WHO. Over to you, Ben.
Thank you, Pauline. Good afternoon or good morning, everyone. I did prepare some slides. I'm not sure if they're able to be shared or not. I can see them coming up now. So I'll just get started while they get put on the screen. So I want to firstly thank the IFRC, particularly the Disaster Law Program, for inviting the WHO Regional Office for the Western Pacific to speak as a technical collaborator. We certainly welcome the report, which is an impressive document, and we think it's a significant contribution to the field, and we look forward to further collaboration with the IFRC and other partners in this area in the future. Next slide, please. The Health Law and Ethics Unit, of which I am part, supports member states in the Western Pacific region to strengthen their legal frameworks for health. During COVID-19, the unit has provided direct technical support to several member states to utilize their existing laws to establish new legal frameworks and to navigate the legal dimensions of the response. And we've also produced a number of regional technical materials as well, which I'd be happy to share with you after this session. Next slide, please. Sorry, next slide, thanks. So it goes without saying that the Western Pacific region is large and diverse, from 1.4 billion people in China to 1,400 in Tokelau. And COVID-19 has impacted countries in our region in dramatically different ways. Yet every country has had to grapple with the legal dimensions of COVID-19, and almost all have had to make changes to their legal frameworks to support the response. Next slide, please. Some common themes and challenges have emerged in our region, and this is just a very, very brief snapshot, and I certainly echo the comments of my predecessors, which we also observed. So legal frameworks in several countries in our region are severely outdated. Some predate countries' independence and are grounded in colonial era objectives and understandings of health. And as a consequence, some countries were forced to quickly enact new frameworks to underpin the response, and others turned to extended states of emergency, which had broader ramifications for the response and for governance. Weaknesses in governance and coordination were quite common, particularly uncertainty over roles and responsibilities as threats emerge and as they escalate. Mechanisms are often focused on national government, limiting the involvement of limiting the involvement of the other levels of government, sectors beyond government, and the whole of society. And lastly, of course, it isn't enough to just have the laws and institutions on the books. The authorities need to have the capacity, the know-how, and the mandate and the legitimacy to actually utilize those. So for example, disaster risk management frameworks in some countries in our region were not used, even though there was the legal basis to do so. Next slide, please. But with crisis, of course, comes opportunity. And right now, legal frameworks for health emergencies have the attention of decision makers and stakeholders. That presents a rare opportunity that may not arise again in our lifetimes. And it's important that we take it. Countries such as the Republic of Korea and New Zealand that used previous health emergencies and other disasters to strengthen their legal preparedness were better equipped to respond to COVID-19. And the IFRC's report comes at a really critical juncture, particularly as we face new and emerging hazards such as antimicrobial resistance and climate change that demand whole of society efforts. Next slide, please. Some additional suggestions for consideration. The focus of legal attention is often on the control of emergencies and restrictive measures, but core health system functions have been critical to success in combating COVID-19. Those include contact tracing, providing access to COVID-19 services and maintaining essential services, and of course, vaccination. And law is critical in each of those areas. And also laws beyond health and disaster risk management have enabled response measures and mitigated against the social, health, and economic impacts of the pandemic. And improving coherence between public health emergency frameworks and disaster risk management laws will look different in each setting, and no single model will be suitable. So I completely agree with my colleague from the UN, DRR, that we should look to formalize processes and practices that worked well during COVID. And a modest aim might be to improve clarity and certainty and to leverage the strengths of each sector. And lastly, major reforms take time. They can be disruptive and they require resources to transition and to implement. And so countries should be realistic about what can be achieved and what their priorities are post COVID. Next slide, please. This is my final slide. So I just want to leave you with the message that Wipro is actively supporting efforts in our region to improve legal preparedness for health emergencies. We're providing direct support to several member states to advance longer-term reforms to public health and health emergency laws and to strengthen the implementation of the IHR. We're building our collaboration with the Disaster Law Program in the Asia and Pacific regions to support efforts to improve coherence and support one another's efforts in those spaces as well. And lastly, we're holding a Law and COVID-19 forum on the 3rd and 4th of November 2021. The forum will feature regional country level experts, including Mayapo from the IFRC, and will be broadcast to the public. And I'll be asking our colleagues from the IFRC very nicely to assist in sharing information about the event so that you can each tune in. So with that, I will say thank you, and I look forward to the rest of the session. I'll hand back to the moderator. Thanks very much.
Thank you so much, Ben. And one of the things that I picked up from your presentation is that your point about the weak integration between health laws on health and other laws from in other or concerning other sectors, and that's exactly what we were grappling with when we were starting this research, because obviously, while this is a public health emergency, it is very much related, and particularly the secondary non-health impacts are very much related to issues that are addressed by disaster risk management. And also to link that to Marco's presentation, where he said that that was also the concern when the Sunday framework was being drafted. It was at the time when Ebola was on the rise, and therefore the recognition that biological hazards should be included in a multi-hazard approach was very much important. And we are seeing the importance of that integration and coherence today. So thank you very much to both our technical collaborators, Marco from UNDRR and Ben from WHO. So it's now time for us to move to the most important part of this event, our panel discussion. And I am pleased to hand this over to the esteemed Miss Adelina Kamal, who is no stranger to us in Asia. Ibu Adelina, as we would call her, is a humanitarian and environmental enthusiast with no more than a quarter-century experience with ASEAN, leading the ASEAN Coordinating Center for Humanitarian Assistance on Disaster Management, otherwise known as the AHA Center, for almost 5 years as its first female executive director from 2017 to August 2021. Prior to that, Ibu Adelina also worked with the ASEAN Secretariat for over 2 decades. Good afternoon, Ibu Adelina. I hand over the moderation to you.
Thank you so much, Pauline, and good afternoon, good morning, and good evening. Greetings from Jakarta, Indonesia. Thank you so much for the kind introduction, and thank you for having me, IFRC colleagues. For the next 35, 40 minutes, I think we are now at 1:45 Jakarta's time. So the next 40 minutes, we'll have a conversation with 4 panelists sharing their reflection, good practices, lessons learned, experiences on the ground, and also their tips for us in terms on the role of law as well as policy in supporting preparedness and respond to COVID-19 in Asia. As mentioned by some of the speakers, you know that Asia has rich experience in responding to mega disasters of catastrophic proportion. Not only that, Asia also has experience responding to previous epidemics and pandemics. So this rich experience must have influenced the way our countries and communities responding to the current COVID-19, including how the legal documents and legal instruments are being used, adapted, as well as developed in the middle of the crisis. So we have a good mix of panelists. There are 4 of them, and I'll introduce them one by one. It's a good balance, 2 ladies and 2 gentlemen. And 4 of them happen to be from Asia, working in the Asian region. 2 of them will bring perspective from the government. 1 of them will bring perspective from the ground. She's a humanitarian actor on the ground, representing the national society. And another one bringing perspective from the UN, the regional perspective. Having a look at their bio and also judging from their experience and having worked with some of them for so many years, I can tell you that they are actually the real superstars, Pauline. So after the conversation with the 4 panelists, hopefully we'll have question and answer. And I'll invite the audience to ask the question, not only to the 4 panelists, but also to the previous speakers. And from that conversations, as well as the questions from the audience, we hope that we can come up with some lessons and recommendation on how to strengthen legal preparedness in Asia in particular for COVID-19, as well as future public health emergency. So now let's start with Sri Kamal Kishore. Kamal, are you there? Okay.
I'm here very
good.
much, Adelina. Good to see you.
Good to see you. So the last time that I met you, we had this lengthy conversation in Jakarta, Indonesia. That was like 20 years ago.
Indeed.
You were still with the ADPC, the
Correct.
Asian Disaster Preparedness Center, and I think you were about to move on to UN, right? And then after that, you worked with the UNDP for almost 13 years in New Delhi, Geneva, and New York. Wow! And now you are with the Indian National Disaster Management Authority.
Yes.
With over 22 years, I think it's almost the same experience, but you started disaster management actually earlier than me in the 90s when you had to deal with the large-scale disasters in India. So you're really like the go-to person in Asia. And good to see you again. It's been a long time. 2 decades, Kamal. So let's chat. As mentioned by Gabby before, that there are this variation, right, in the way Asia, in the way countries responding to COVID-19. And that is because of the governance mechanism, because of the response capacity. And you heard about this public health emergency dominant, and then the hybrid, and then the disaster risk management legal instrument dominant. So where is India? I heard that the National Disaster Management Authority of India and the disaster risk management instrument in India actually play a major role in responding to COVID-19. So, okay, you're nodding. Why? You know, what actually were the actual reasons for that? Was it like different responding and preparing for public health emergency and disaster? I know you have responded to large-scale disasters and had the instrumental experience in this. So tell us the difference. Over to you, Kamal.
So thanks, Adelina. So in India, the Disaster Management Act of 2005, which was enacted less than a year after the Indian Ocean tsunami, was the main legal instrument that was used in responding to the pandemic. And I think I have to give credit to our lawmakers back in 2005 for having the foresight to come up with a legal instrument which could be applied in a disaster which affects all of the country at the same time. India is a large country, second most populous country in the world. So, you know, among the whole range of legal instruments available, Disaster Management Act, as well as an Epidemics Act, which was like more than 100 years old, Disaster Management Act was the most appropriate instrument that could be used for mobilizing a response to contain the effects of the pandemic and respond to effects that were emerging. This was an instrument which basically nicely aligned the national, subnational, which in India's case, state and local levels. And it had enough provisions for a good balance between the rights and privileges of rights and responsibilities of the affected people. You know, rights to information, right to support from the state, but also their responsibility, because we were faced with a situation where the actions of one person or one administrative entity, action or inaction, would have a bearing on the well-being of the ones next to them. So I think that's why it was, you know, a 21st century legal instrument, and it was applied in this. Now, what is the difference between the pandemic response and the any other disasters? I think I would like to highlight three things. One is that we were dealing with a lot of uncertainty and evolving scenario very quickly. You know, if you remember very early days of the pandemic, just to give you an example, we were being advised that, you know, don't buy masks because they are for health workers. And very soon, by April, May last year, we began to say that masks are your first line of defense. So likewise, there are many other dimensions of the hazard itself, which was trickling in. So what this required is, continually adjusting your approach. The Ministry of Home Affairs, which used, and the National Disaster Management Authority issued something like more than 300 orders, 400 orders or 400 notices about what needs to be done. On one hand, there was some groups who were saying, oh, they can't make up their mind, they keep changing. But on the other hand, this is an example of adaptive governance. You change your approach as you know more about the hazard. So I think that is one thing. This is not the kind of thing you see in a large earthquake, which happens once and one big shock, and you're dealing with a very clear parameters, or a flood or a landslide or a cyclone. So I think that was this thing. So the lesson embedded in that is that it has to be an adaptive instrument. The second thing is that we had a mechanism to sort of work across administrative levels. So national, subnational, local. But what about horizontal? Between states, who coordinates? I think this is something we haven't experienced to the same extent in the other disasters. And the third and final was that, you could say that for any other disaster, but here you had to take every single individual in the entire country. You had to mobilize the energies and participation of 1.3 billion people at the same time, even those who are not affected at a given point of time. So I think these are the three things which I would say are not entirely different, but substantially different from a regular disaster response that we've done in the past.
Thank you very much for that. You reminded us that this 2004 Indian Ocean tsunami that hit not only India, but also Indonesia, my country, Thailand, where Amy is from, and many other countries, Maldives, where Fatima's from. And that actually is the 21st century instrument that we have used. So it seems like you're into this DRM, heavy inclination, right? And it's very good because you're using what is available for coordination mechanism. How did you work with the colleagues in the health sector? Who's actually taking the lead, Kamal?
I have to say that in the beginning, at least, you could see that there was, you can say, a cultural difference, institutional cultural difference, in the way the public health system works and the disaster management system works. For example, in the disaster risk management system, we are more used to actually doing drills and mock exercises and practicing the response, whereas the public health people are more focused on setting standards and providing normative guidance. But I think very quickly, within a few months, we came to a very good understanding and looking at the complementarity of the pharmacological response and non-pharmacological response. So while pharmacological response needs to determine, for example, what is the kind of requirement you would have for oxygen for what case load, but how do you organize the logistics chain for that? What is the kind of legal instrument you need for movement of oxygen? And I'm just giving oxygen as an example, from one part of the country to the other in a swift manner. How do you requisition resources from different parts of society? That is, classic logistics management for disaster risk management. So I would think that there was, in the end, at present, for example, there is a good complementarity, good appreciation. Another dimension of that complementarity is how we work with civil society organizations in reaching every single person with the message of disaster preparedness, classic disaster preparedness. What do you do when a flood occurs? What do you do when cyclones occur? What do you do when landslides occur? So we use some of the same channels to push public health messages. Those existing relationships really came in handy. Same in the vaccination drive. Just yesterday or day before yesterday, I had participated in an event where the local administration, civil society in a particular district have achieved 100% vaccination. But that is something, it can't be done just by government alone. It really requires partnership with civil society. And you don't begin to build those relationships when a disaster has occurred. You need to have them in, so-called peacetime.
Okay, the last question before I move to the other speaker, I heard, and you can correct me if I'm wrong, that you're currently, the government of India currently reviewing the disaster risk management framework or legislation that came out of the Indian Ocean tsunami. Is it what's happening, and are you planning to take into account the lessons learned from
Yes,
COVID-19?
absolutely. I think.
Yeah.
Thanks, Adelina. Yes, absolutely. There are many lessons from the tsunami which will inform, what our lawmakers decide in terms of the next generation of disaster management law. But this is not something which is unique to India. I think if you look at the history of disaster management legislation in the country, I think the beginning of this century, after the tsunami, was a time when a number of countries enacted. I can imagine, if I remember correctly, Indonesia, Sri Lanka, Maldives, Thailand, India. I mean, 5 majorly affected countries from tsunami, they came up with legislation. Perhaps now there is a time for the next generation of disaster risk management legislation, which incorporates the lessons of the pandemic, some of which I just highlighted. And I think what has worked very well is I'm quite intimately familiar with, of course, our legislation, but also Sri Lanka, that they have taken a multi-hazard approach. So the law itself does not, it defines what is a disaster and what is a disaster risk in very broad terms. And I think I remember having those discussions in Sri Lanka as well, when with UNDP, we were supporting the government. And there was one school of thought saying that we should have a list of disasters. And then there was another school that we should leave it open because we may not know all the types of hazards that are lurking in our system. And I think that has really worked well. That has served us well. So that is something to be preserved. But I think a few things. One is horizontal coordination between geographic entities at the same level. Looking at how penal provisions should work or should not work. Like if you are, most countries have had this mandate to wear masks. How do you enforce that? What is, at what point of time, how much role do you have for people to receive the risk information that, look, if you don't wear a mask, it's a risk. And to what extent you also need to provide them support that, that masks are freely available. It's the state's responsibility to make them available in an easy manner to, each and every part of this thing. So I think that balancing, how does that happen? So I would think that, countries in the next round of disaster risk legislation will look at these things and address them.
Thank you for mentioning that. So it's not only, the disincentive or things to pressure, such as laws, but also the incentive, and that's also the role of law and policies in public health emergencies in enhancing our legal preparedness. Thank you for that. Now I'll get back to you, Kamal, and I'll now to Maldives. We have the Secretary General of Maldivian Red Crescent Society, Miss Fatima Himya. Can I call you Fatima? Good to see you. I've been following you through Twitter. You have 10 years of experience in the humanitarian sector. And even before you became the Secretary General of the MRC, you actually were instrumental in setting up the Maldivian Red Crescent. You're also the co-chair of the Red Cross Red Crescent Asia Pacific Migration Network and Migration Leadership Group. Also a member of the GLOW Red, I love that. And I Googled, GLOW stands for Global Network for Women Leaders in the Red Cross and Red Crescent movement. And you're also a strong advocate to increase the representation and participation of women in all levels in national society. Good girl. Okay, we need to stick together, yeah, ladies. As the Secretary General of the Maldivian Red Crescent, you're the auxiliary to the government. How has the MRC been legally recognized in the country? And how that has helped in performing your role as the first responder in COVID-19? And what's the difference? If you're not legally recognized, what's the difference? What could happen differently?
Right. Thank you, Adelina. And to begin with, Maldivian Red Crescent was formed after the tsunami, actually, and were recognized by law, and we came into existence in 2009. So, I mean, similar to many other national societies of the IFRC, we are also recognized by law in the country. And the difference between other NGOs and, national societies is that we have this legal base and we're recognized legally in the country. Like you said, our main responsibility is to act as an auxiliary to the government. And also we are recognized by law as the main or a major responder, a humanitarian responder in emergencies and in disaster situations, So this actually gives us the room to function well, to provide the humanitarian assistance when needed, especially in communities. Like I said, MRC is just 11 years old, and we would not have been able to do the work we've been able to do in these 11 years if we had not been given, the room because of this legal act that we have. So the MRC Act is, the basis of our work. It acts as a tool for us to advocate, especially when it comes to advocacy with state authorities. And it's also a tool that we can use with the community, trying to explain to them what our role is as a humanitarian organization and the work we do, So I think it really helps and supports us and strengthens our existence and our work and our purpose in the country. And on many occasions, especially when it comes to advocating with the government and state authorities, we've been able to use our legal base as a strength and as an advantage for us, especially when it comes to providing humanitarian services and assistance in very critical situations and in crisis situations. And I think it's also helps us to build that relationship with the government, like the trust that's very important for any organization, any humanitarian organization to work, especially during emergencies where, we need to do things in seconds, literally, and we have to take the word for each, of each other, or we need to have that understanding and in the legal base we have, it says that agreement, so that we don't have to always have, agreements for each and everything that we do, So it really helps us to get things done quickly during crisis situations. And I would say, especially during the COVID pandemic, it really helped us because we had this, MRC Act in place, and we already had a very good working relationship with the government established from the very beginning. So building trust, it really helps us to do so. And like I said, it acts as a recognition for us. We're working with other non-government agencies like the UN agencies, when we go into the communities and when we work at the ground level, in communities. We have to work with the island councils, the hospitals, and different stakeholders. And usually they would ask, "What's the mandate?" Like sometimes they might perceive us as any other NGO, and sometimes there's a trust issues, with civil society organizations. So it's very, easy for us to say we are in existence by law, and this is the work we do. So I think that's something I think I would really want to highlight. And the difference is that people recognize us and people accept us more, because of this legal base we have. Yeah.
Thank you for that. And you've mentioned that you work closely with the government, and you have actually the existence of your legal recognition also help build coordination as well build trust with the government. So you work with different government agencies, not only the health sector, but also the disaster risk management sector, and perhaps other sectors. So how did you see that coordination? I don't know whether you can share your observation, and how clear coordination among them will also help the work of the Red Cross and Red Crescent national societies.
Yeah, I think one of the advantages we had, being a small country, was it was easier for us to coordinate better. We are a relatively small country and a very small population compared to other countries in the Asia Pacific as well. So we were able to set up initially. I mean, let's talk about COVID, because it's the most recent experience we've had. So we were, from day one, we had a National Emergency Operations Center established, and all relevant stakeholders and state authorities, including Maldivian Red Crescent, were physically present, and trying to ensure that we had a proper coordination mechanism set up, and that we had proper communication within agencies. And it was, like everyone refers to it, a multi-agency response, and it required that we all coordinated and communicated together. But it was a very learning by doing experience, I would say. And I think based on some of the points highlighted by some of the speakers, I think this is the first time, it's a public health emergency of this scale. So usually we are very used to natural disasters like flooding and, weather-related emergencies. But even in the Maldives, what we recognized was that there was a confusion on who would lead, this response, because normally it would have been the National Disaster Management Authority by law who would respond to, such emergency situations. But given that it was a, public health emergency, so the Ministry of Health or the health authorities were also taking a very lead role, in responding. But I think we also identified that public health authorities lacked that capacity to respond to an emergency, because the capacity and the experience lied more with National Disaster Authority, because they frequently, respond to such situations. So during this process, there were times where the lead agency also changed a couple of times. Even within the state authorities, we were trying to figure out, how to work things out and how to have a better coordination mechanism. But I think we were able to somehow work it out, because we already had very close working relationships established, both with state authorities who worked in disaster management and also health related authorities. So it wasn't a challenge as per se, but I think it took us time to establish that coordination mechanism and to finding the right setup for us to work, especially given COVID, that, it was locked down and all these restrictions and everything. So it was very challenging. But I think one thing we really need to consider when we talk about all of society, all of state approach, is that we need to build up to it. We can't do it when an emergency happens. So I think it's something that all countries need to build up. We need to establish working modalities beforehand. We need to build partnerships before something happens. We need to build the trust within, interagencies and organizations and stakeholders. We need to build capacity, again, among the relevant responders and authorities who would respond to such situations. So I think when we say we want to have all of society, all of state approach, there are a lot of things we need to do, to get there. So what we realized even during the pandemic response was that we are not as prepared as we hope we would be. And I think especially working together as, a multi-agency approach requires much more effort and much more coordination. So I think that's what we realized from the response we had.
Thank you.
Yeah.
And I don't want to leave you with this question before I move to the next one. I really want to ask this question because I know that you're passionate about this, and this is about protection of the most vulnerable. And some people, actually I've learned from some that Maldivian Red Crescent has done actually quite well in terms of protection of the migrant groups. And this includes not only the legal, but also the illegal, the IDPs, the refugees, those coming to your shores. So what were their challenges? What were your challenges? And how would policies and law help you and help them and help the government?
During the COVID-19 response, one of the main areas of response of MRC was to attend to the needs of the migrants. And like you mentioned, especially the undocumented migrants. The challenges we faced was mainly the lack of access to information, the migrants had, mainly because of language barriers. And, a lot of information was circulated, like press conferences, daily updates of the, situation when the COVID-19 disease was spreading quite fast last year. And, we had to do the translations regularly, and we had to make sure that the migrants also had, the necessary information of the situation in the country. And again, an additional challenge to that also was a lot of migrants in the Maldives are unskilled laborers, and they do not know how to read or write. So the high illiteracy rate really made it a challenge for us to, communicate the information to them. So we had to find out different mechanisms of communicating to them, like using, audio messaging and all that, so that, the messages was received by the migrants. And also access to healthcare was another challenge that the migrants faced, mainly because they didn't have, the proper documentation. So we were able to partner with the government. Obviously, we were able to do this because the government provided us the space in the room to do this as a humanitarian organization and actor. We were able to register the undocumented migrants with Maldivian Red Crescent and provide them an identification card so that they had access to healthcare, like screening for COVID. And, and currently, even with the vaccination, we are doing the same, where undocumented migrants who do not have any form of identification, so they don't have a passport or they don't have a work visa, they don't have any form of, formal document that recognizes them as who they are. So we provide them a beneficiary card, an identification card, and even currently the vaccination program is also ongoing through this. So again, like you asked, what is the advantage we have? I think it's because one, I would definitely say if the government of the Maldives had not created that space for us, we would not have been able to do it, right? So it's important for the state authorities to exempt, humanitarian actors and organizations from some of the regulations when we need to function and when we need to respond in crisis situations, So I think the government of the Maldives did that very well, where they exempted Maldivian Red Crescent from certain, regulations that we were as a humanitarian organization, we could function freely, in this space and provide the humanitarian assistance required to the most vulnerable people, especially the migrants, like you said.
Thank you so much, Fatima. So I'll get back to you. Hopefully we have time for entertaining question. There's one question coming to the Q&A box. If you could kindly look at that, and it's addressed to you especially. Now let's move to the other lady. I just realized that I have spoken to people from 3 countries that have experienced the world-class disasters. Indian Ocean tsunami, right? Thailand included, Maldives and India, and of course my country, Indonesia. And then now we go to Thailand, and Thailand also experienced the mega flood in 2011. And this lady was the coordinator, the foreign relations coordinator at the National Emergencies Center during the mega flood in 2011. That was 10 years ago. Miss Panapanan, sister, I call her sister, ladies and gentlemen, because we have worked closely together in ASEAN for quite some time. Amy, I call her, is the Director of International Cooperation Section, Research and International Cooperation Bureau under the Department of Disaster Mitigation and Prevention of Thailand, the future of ASEAN leaders in disaster management, or already the leader. Been with the DDPM for over 12 years. Apart from coordinating foreign relations in mega flood disaster, her current responsibility also includes international humanitarian assistance, civil military coordination, being the coordinator for Thailand for ASEAN and international cooperation for disaster risk management and disaster management, also instructor in incident command system, also a certified member of the UN disaster assessment and ASEAN ERAT, of course.
Yes.
So Amy, thank you so much for joining us. Bangkok principles have been mentioned a number of times. So why did the Thailand government help formulate it and also champion it? And it was in 2016. So Marco said it was in 2016, right? And now COVID. So how did COVID further amplify the importance of Bangkok principle?
Yeah, it was very interesting because, the Bangkok principle was actually commemorated a year after the Sendai framework, because of course it's 2016. After the Sendai was commemorated in Thailand, our Ministry of Public Health is very active. They are always trying to find a way to advance in emergency medicine. So they hold this big conference, the senior official conference on the public health and disaster risk reduction. And that's where actually there's one of the first event that combined those 2 elements together. And at that conference, they announced and endorsed the suggest the Bangkok principle, where stating something that in disaster risk reduction, you have to be aware of the public health issues, and always the people who work in the public health sector need to be aware of the contingency or events that might happen during their emergency as well. So they need to be, prepared. They need to have the contingency plan. And people who is in the field of disaster risk management or disaster management need to be aware of the elements of public health that might happen during the incidents that they respond to. And this just happened that, in the past year, our UNDRR and UNESCAP come to talk to the DPM and asking, that it's about time to promote this principle. And it's a COVID situation, and it's just in conjunction perfectly. We've been prepared for this.
So again, the same question that I posed to Kamal. How did you work with the health sector as well as the other ministries and also the other sectoral, the other stakeholders? And how did you promote the Bangkok principle? Because you cannot just preach for it, right? In 2016,
yes,
you've got to implement it and champion it.
Yes, The thing is like our NDMO, the place DDPM or NDMO that of Thailand, we work very, very closely with our Ministry of Public Health and also the National Institute of Emergency Medicine, as well as the Thai Red Cross and other entities that in the public sector, the WHO also, and UNDRR. You know, and last year we start promoting this Bangkok principle. The first thing we did last year, about a year ago, we actually did a webinar. This is one of the first webinar that we introducing the Bangkok principle to the Thai audience, you know, explaining what exactly is Bangkok principle. So we starting from our DRR focal point according to the Sendai, and we, you know, give them information. And now we, the Ministry of Public Health also come up with the implementation plan of the Bangkok principle. So, and on DDPM, my organization is also drafting a plan or providing a series of educational, you know, webinar that we can educating both the public sector and also disaster manager on DRR and public health and how they work together. So I think, and how we work together in emergency is according to our national plan, which the structure will lay out very clear that, you know, we have emergency support function, which responsible for health sector. So those are the cluster that will be coordinating among the health related issue during the disaster. So, and with the COVID situation, there are the central agency that the PM actually sitting on the chair as the chairman, and he call in the meeting every day on the COVID situation, and Ministry of Public Health is also the key person who run everything, and we have different ministry in charge in different issue. So that's how we coordinate, and we make sure that we got the same picture. We have a spokesperson that go out and also provide the same information at all level.
Thank you, Amy. You've mentioned in one of our informal conversations, and I know that from your pictures in the Facebook, that the DGPM Thailand and together with the other agencies are helping the migrant workers and the fishermen. And you told me that these are both the legal and illegal.
Yes.
And you don't have, and you also have to work with the other ministries that normally are not in the picture when it comes to flood or other disasters. Can you tell us about it? Why is it important? What actually were the challenges when it comes to protection of migrant workers? And do you have like the sufficient policies and regulation to help you in addressing these challenges for you as well as the workers themselves?
Definitely. DDPM, the NDMO that I'm working with is under Ministry of Interior. So one of our mandates is looking over the crossing border of the, you know, the foreigners as well. So the attention came to us when there was a cluster that's starting actually the one that started third wave of the COVID-19 spreading in Thailand earlier this year was from the fishery worker, who's mostly are immigrants and mostly are illegal because they are working on the boats and in the sea. So when they caught COVID-19 and it spread over to the shrimp market in Samut Songkhram, where is our port province, which have more immigrant worker than its own population. So there were about 300,000 migrant workers in that just one province. So it's very interesting. If you, in Thailand, you pass through that province, you will see Myanmar language all over the place. If you go to ATM, you see Myanmar language. So the province actually, you know, have equipped with how to communicate with immigrant workers. But then with the COVID-19, we are mandated to provide care to them the same as our citizens. And also is because with our National Center for COVID-19 Response, with the Prime Minister at the head of the chair of the committee, they also under that is Ministry of Labor, who's in charge. And I think it's 2 weeks ago that the Ministry of Labor has just passed the law or proposed the law to the cabinet on how to release strict the rule and regulation for the migrant worker during the COVID-19. So they're extending the period of time that they would need to extend the visa. They are working closely between the Ministry of Labor, Ministry of Public Health, and also Ministry of Interior, combined into a task force and go through the different factories to do the screening and to do health communication for the COVID-19 and provide them with vaccine and also provide them with quarantine and care package during that time when they caught COVID-19. And that probably brings me to the assistance from ASEAN, actually. You know, the ASEAN leader was providing utilizing the disaster emergency logistics system of ASEAN or DELSA to provide assistance to the ASEAN member state during the COVID-19 response. And Thailand is the one that are also asking for that as well. Most of our relief items from ASEAN were provided to those migrant workers as well. So I think it's actually one of the opportunity that we can actually collecting data on the actual number of migrant workers in our area of responsibility.
Since you mentioned about ASEAN, and not because I worked with you before, but it's interesting that we use the ASEAN mechanism, the DELSA, the Disaster Emergency Logistics System, to help these people in Samut. So what would be the opportunities? What would be the opportunities to strengthen ASEAN mechanism in public health emergencies, building on our disaster management mechanism? Not I think that I want to glorify our own mechanism, in disaster management, but what can they learn based on our own mechanisms?
I think what we did very well was that there's actually a funding from the Lake Relief that providing to ASEAN member state in response to COVID-19. And my DG was actually come up with this COVID-19 personal hygiene kits that catering to the vulnerable groups. I think that's one thing that we could be one of the lessons learned of how we can improve our stockpile. And it was received very well because the COVID-19 personal hygiene kit that DDM customized to for our situation was there's 3 types. The regular one, which we adding in the mask, the alcohol gel, and also we catering one of the type to the babies, because we did understand that during the disaster, not only COVID-19 but also regular disaster, babies would need something else. I believe that, and also the other package would be for the elderly or the people who's injured and in bed, and that would be they would have the adult diaper or something like that. And I think also that Thai Red Cross also doing something like that. They catering certain care package, a certain personal hygiene kit or whatever that they're providing during the relief operation to the vulnerable groups, because a lot of time the vulnerable group is actually overlooked or not really have the attention enough during that emergency. So I think one thing that we have to keep in mind also, the issue of gender inclusion and protection is becoming one of very, very important thing that we want to push to get more attention in the international fora as well as at the national level.
Thank you for that. So we have actually a lot of experience in the DRM sector with regard to the logistic and also preparing for something before it happens, also coordination and putting in place some financing mechanism to allow that to be actually utilized. And that's something that actually the public health emergency sector in ASEAN could make use, right? And they're now setting up a new ASEAN center, while we already have this mechanism, a HA center, together with the regional stockpiles, including the one in Thailand. Okay, so Amy, there are some questions with regard to regional mechanisms in the Q&A. If you can answer them rather than type the answer rather than answer them lively, would you kindly attend to that? Now I would move to the 4th speaker, Dr. Sanjay Srivastawa from the UN ASCAP. Thank you, Amy. it looks like we're going to go beyond the allocated time because we started quite late, like 15 minutes late for the panel. So apology for that. And Mr. Kamal Kishore has left. And actually there was a question for Kamal. So we'll make sure that this question will be entertained later. Perhaps we can send the question to the one asking the question later. But I would like to ask before Dr. Sanjay started for the panelists as well as the previous speakers to kindly look at the Q&A box, and if you can answer and write down the answer, kindly do that. Now, Dr. Sanjay, thank you so much for waiting. You're the chief of the disaster risk reduction at the UN SCAP. You've been with the SCAP since 2009, and prior to that, you were the head of the SARC, the equivalent of the AHA Center, but in for South Asia in Delhi. And you're also with the Indian Space Research Organization. And you're also the author of more than 150, not 15, 150 publications on disaster risk reduction. And you're also the lead author of the SCAP flagship publication, the the Asia Pacific Disaster Report, since its inception in 2010. And you just launched the new publication, Asia Pacific Disaster Report 2021, called Resilient in a Riskier World, where you actually reminded all of us to look at the more joint approach in our laws, policies, and action. And not only just to talk about public health, pandemic, but also climate, apart from disaster. Given the fact that Asia Pacific is actually the home to world-class disasters. So can you tell us why you champion this joint approach, and how the data collected in the recently launched Disaster Report 2021 will support that collaborative and coherent approach? Dr. Sanjay.
Yeah. Thank you, Adelina. Thank you very much. It's always a pleasure to meet you, discuss with you on many outstanding issues related to DRR community. With regard to your question, first of all, let me thank our IFRC colleagues for excellent quality of the report. I think this is very well on time. Most of the countries are struggling to relook at the laws, the frameworks of disaster and public health emergency. So it's very timely. I would like to share a few of our experience. This is not very different from what is there already in the publication that was presented by Gabby. But let me shed some light. My colleague Amy is here. We were mandated, UN, particularly SCAP, is a multilateral, regional economic commission. So whatever we do, it has to be mandated by the member countries through a resolution. So there was a resolution this year in May, in the peak of the pandemic, and also the disasters together. So it was a real cascade of climate extreme and disasters together, and countries are, you heard many of countries' experiences. They were confronting with this. Now, the idea came what the UN can do to address the cascade of climate extremes, the health emergencies together. And that was the time mandate given to us was to take forward the Bangkok principle, because those who are aware of the Bangkok principle, they were aware, I think my colleagues from UNDRRC highlighted, it was with the backdrop of Ebola and many of the pandemic in Africa. So there was already experiences behind the Bangkok principle that when you were negotiating Sendai framework, there was, more, I should say, the focus on extreme climate event. That time it was with the backdrop of the floods, the Fukushima earthquake, tsunami, and all triple disasters, nuclear meltdown. So the voice of the health sector in particularly public health emergency and DRR, somehow were not very extremely visible, like what it was in case of major earthquake or tsunami. But the Bangkok principle could able to bring this voice again. And that's why Bangkok principle is very well suited in the present context. Now, coming to what you said, Arlena, was the joint, the maximizing the synergy and climate. What we did for taking Bangkok principle forward through a regional cooperation framework or approach, we examined what my colleagues gave presented, the disaster dominant framework, the DRR dominant framework, and health dominant framework. The building disaster and climate resilience, which is of course driven by Sendai framework, then Bangkok principle. When you take the health dominant framework, which was very well articulated by WHO colleagues, also that was the WHO Health Emergency and Disaster Risk Management Framework. So when we brought this framework together, I think there is also a SDG 3D, Sustainable Development Goals, health and well-being, and that was on the health-related early warning system, health surveillance, because these are some of the areas which brings disaster and health together. So what we did in Asia Pacific disaster report was we analyzed and brought out what are the areas where there are synergy and what are the areas where both disaster and health could be brought together. And this is where law can take it forward. What we would like to highlight, I have just 4 points to share with you. We felt that if there is a policy coherence between health and DRR sector, you heard quite a bit on this, already implemented. There are very few countries where this policy coherence is in place. This is a good strategy of bringing these two sectors together. There are another important point is the integrated multi-hazard early warning system. This is where I would like to bring some element of innovation in the recent times. You know, if you look at Adelina, a multi-hazard risk hotspots, there are many health-related issues, many waterborne, vector-borne diseases. If you go to heat waves, there are already called the vascular diseases. So there are many areas where disaster and health, disaster triggers health emergencies. There are 25 to 30% of the water and vector-borne diseases which are triggered by disasters. We brought out in Asia Pacific disaster report, we brought out those hotspots where this trigger happens and where you need to enhance your health preparedness, taking advantage of disaster early warning system and so on. So this is one area where there is a lot of innovation, particularly with what we call machine learning, which early warning system for particularly the water and vector-borne and malaria. You use the indicators which are related to health surveillance, indicators which are related to the environmental indicators, the pollution indicators, bring it together through machine learning, and you can enhance integrated multi-hazard early warning systems. We say has health and hazards together. It works in certain cases. With pandemic, you will see a lot of acceleration in this area. My third point is resilient infrastructure, particularly health infrastructure. We have spotted those areas where there is a disaster and health together, which has what we call nexus of disaster, climate, and health. And in those areas, you build a resilient infrastructure which are customized to the normal diseases which are triggered by disaster or the climate extremes. So you can address both disaster and health together. Last but not the least is the climate change adaptation. There are extremely variety of new innovation in adaptation to the health sector, agriculture sector, water sector, DRR sector. But when you look at the cross section of the adaptation, you will see quite a bit of the common areas which are important to take it forward. Your last question was, what are the data that we have brought in? I must share with you that this is the fundamental needs for bringing these two sectors together. And we have developed risk and resilience portal, which is available online, where you will see DRR and health nexus, what I was talking to you, the hotspot of disaster and health, and that will be very useful for member country, especially for risk-informed policy planning and investment. So thank you, Elena. I hope I could be able to answer some of this.
Thank you. Excellent. And I would encourage colleagues to look at the report because it's fascinating. And congratulations for coming up with that report. And you mentioned in your report some recommendation for the different sub-regions in Asia Pacific. So now let's talk about regional cooperation, because you're overseeing Asia Pacific. Kamal mentioned about working together between India and Sri Lanka, right? And of course, in ASEAN, we also have this kind of a regional cooperation, also SAARC, and the Pacific also very strong in terms of the regional mechanism. So can you share with us any of these recommendations from your report that talk about this regional cooperation based on your analysis, and if there needs to be some kind of areas for strengthening, because of course every region is different. But you clearly mentioned that there are things that the public health sector can actually utilize, things like early warning, things like risk management, things like recovery, right? The whole spectrum. But then let's talk about regional cooperation. What can be done in this regard? Thank you.
Yeah, thank you, Elena. I think one area which I would certainly like to highlight is very well established. The science is very clear on what we call disaster, climate, and health nexus. But this nexus is very different in different parts of the world, and particularly in Asia Pacific, it's quite different. When you go to the Pacific, this nexus has a very different composition. When you go to Central Asia, it's very different. In Southeast Asia, very different. South Asia, very different. So what we have done is, we have examined, there is a framework of, WMO framework of climate services, and they called Regional Climate Outlook Forum. So for example, if you take ASEAN COF, ASEAN Regional Climate Outlook Forum, what we have done in this report is, we have done a deep dive in ASEAN region in Southeast Asia, and we have spotted out, based on all analytics that we have used, including the WHO analytics, particularly on the outbreak of water and vector-borne diseases triggered by the floods, triggered by the cyclones, drought, and so on. So we have looked at disaster in conjunction with the outbreak of diseases. So, and those are very, very, like, you know, Adelina, in a tsunami-prone area, you know, the fault lines. And fault lines is like your center of the risk, epicenter of the risk. Here in this case also, in the hotspot, you have a nexus which exists, disaster, climate, and health. So when you identify the nexus, and based on this nexus, you build a regional cooperation among the ASEAN countries, take the advantage of ASEAN COF, South Asia Climate Outlook Forum. Similarly, South Asia Climate Forum, what we call SASCO. So this is something you use science to build the cooperation among the health ministries, because the climate framework now comprises 5 areas, which is disaster risk reduction, health, water, agriculture. So if you take 5 sectors together and build a regional cooperation mechanism that is purely based on the science, I think this is a new experience coming from this cascading risk, what we are experiencing today. My last and final word, we saw this after tsunami. We built Indian Ocean Tsunami Warning System. Those countries in Indian Ocean basin who have a common risk, of the fault line of the tsunami. Indonesia, India, Sri Lanka, and Thailand had been working together as a part of IOTWS network. We should have a similar approach for a cascading disaster risk, especially cascade of disaster health and climate nexus. So I think this is one area which has huge potential in coming days to build or to deepen the regional cooperation.
Thank you. Wow. Okay. I want to discuss a little bit more with you, but perhaps some other time. Now, let's go to the Q&A. Thank you so much, Dr. Sanjay. We actually were informed, I was informed that many of the questions in the Q&A have been answered. Thank you so much by the speakers and the panelists. So now we are like 50 minutes, more than 50 minutes beyond time. Can I ask whether, okay, there are 5 questions, 2 for, I think for Fatima, would you like to answer that? And then I think one, okay, one is about regional mechanism, and Amy has left and she wants me to answer that question. I'm not sure whether I have that answer, but let's see. And then the other one is about, okay, from Agit on the RCRC. So perhaps either Gaby or Catherine would answer that. So can I ask who wants to tackle that first, either Fatima or Gaby?
Yeah, I can go first. I think I have 2 questions. I'll try to keep it very short since we're running out of time as well. Regarding the question whether volunteers and staff required legal empowerment by necessary authorities to respond or carry out contact tracing, Maldivian Red Crescent did not directly get involved in the contact tracing efforts of the Ministry of Health, but we supported the call center efforts of the Health Emergency Operations Center when it was established. So we did not directly contact for contact tracing purposes, but for other services, like I mentioned, providing access to healthcare and also our support in getting registered for the vaccination efforts, we do not require a separate legal empowerment to carry out our work. And the question about which is the most down-to-earth community connected health provider in the Maldives, I would say we don't have many different health providers in the country. The main health provider in the country is government, and we have government hospitals and health centers across the country in all islands as well. Health centers are also run by the Ministry of Health. So we have very small individual private healthcare clinics similar to other countries, but we don't have specific large community health providers in the country. So I hope that answers the question. Thank you.
Thank you so much, Fatima. Now, perhaps Gaby or Catherine would like to tackle the question about the experience in terms of law, especially between state and RC movement. That's kind of like a big question with a lot of answer. But would you like to tackle that briefly, Gaby?
Sure, I can try to take that one on. So first of all, I'll just respond about the Red Cross, Red Crescent movement. So I would say as a non-government entity, although with this auxiliary function, Red Cross and Red Crescent probably had greater access than many of the other civil society actors, and that's down in large part to this kind of recognised and formalised role as an auxiliary, which has been formalized into various laws and policies, which meant that they were still able to operate both within the country and also to be able to support each other during the response. So I think that really shows that it works, and it's maybe what other organizations need to look for as well. However, in saying that, it's not to say that many of our national societies and IFRC didn't come across some challenges. Certainly, there were restrictions around some countries put like export bans on exporting PPE material, for example, which also affected our operations. in terms of the usual kind of trans-boundary cooperation, we constantly come up with issues around customs issues as well. So I think in terms of both disasters and public health emergencies, you know, how we can get some of those frontline agencies also operating, you know, in a timely way, in an expedited way for emergency situations also needs consideration as well. I'll leave it there. Thanks, Adelina.
Thank you, Gabby. Now, there is this question from Dr. Kian Spendler that I know him, and thank you so much for the tough questions, Kian. And he's asking about where ASEAN is going to put the COVID-19 response in terms of fund, in terms of institution, in which institution or regional mechanism. So I guess perhaps the question whether it's going to be more under the health sector in ASEAN or under the disaster management sector or under other sector, what has worked and what has not worked. I don't have that answer, Kirian, because it's actually still being developed. There is this so-called ASEAN CDC or ASEAN Public Health Emergencies, and perhaps colleagues in the ASEAN SCARE and AHA Center would know better, or in the health sector. But I know that some countries in ASEAN actually are eyeing to become the host of that center, and there is this Emergencies study that has come up with the requirements for this center to be established. And there is this ASEAN COVID-19 response mechanism, but the ASEAN leaders have actually encouraged for the existing mechanism, not only the new mechanism being set up, but the existing mechanism that already been there, including the AHA Center, to support, not necessarily to take the lead, but to support. Where to put, I don't know. I think this really requires discussion, and the way I said, even learning from governments, and like in India, in Thailand, in Maldives, and other countries, and also looking at the report, is really important for the health sector and the disaster management sector to sit down together and not like, you know, okay, this is my card and this is your card, you know, don't touch my fund. You know, no, it cannot be like that, because as mentioned by, you know, our speakers, there are things that the disaster management sector can offer. We are used to contingency planning and exercises like what Kamal Kishore said. And then there are also things that the public health sector can offer. There are things that, you know, the climate people, the meteorological center, whatever, it can also offer. So I guess the problem is too large for this basically, you know, power struggle on where to actually put the institution. And I hope that the right decision will be made for that. So I don't have the correct answer, I think, because it's still an ongoing process, and I'm out of the ASEAN system, so I don't want to also imply that it's going to happen that way. Now, I think we need to conclude. So I will make a brief remark, kind of like conclusion. The way I say it, pandemic is far from over, but there are things that we can do actually from now, and that can be done by the government, within the government, across the different government agencies, and also at the different level, and also with the other sectors. I think it's really important for each of us, the actor, to understand what actually is needed. And all of this actually can be clarified and can be provided through clear policies and clear laws and clear plans. The time is now. Mr. Jagan, the Secretary General of IFRC, has mentioned in the Global Lunch, the time is now. It's probably once in a lifetime opportunity, guys, to review our lessons and our mistakes and what can be done to improve, right? To improve our response. And okay, we're learning by doing, you know, in terms of the use of us and all that, like Kamal mentioned, we all are learning by doing. But I think we will be wasting our time if we are not actually making the revision necessary, the improvement necessary in terms of laws and policies as the invisible foundation that are necessary to ensure our preparedness and response for COVID-19 and future public health emergencies. So I'll stop at that, and I'll ask any other speakers who would like to speak briefly, just to add before we close, and then I'll turn to Gabby as the last one concluding. Any of the speakers? Catherine, Fatima, Bill, Ben, Dr. Sanjay, anything? Okay, so since it seems none, can I invite Gabby to close our today's discussion? Gabby, over to you.
Thank you so much, Adelina. It's been a really wonderful panel that you've moderated, and a huge thank you to all our wonderful panelists and to our expert and technical collaborators as well. I think there's been such richness in this discussion, and I certainly have learned a lot that I'm going to be reflecting on in terms of the real reality of how this all works, all these laws and institutions, and what this really means, where it matters most, you know, at the national and the local level. So there's certainly a lot that I've taken away from it. But I'm going to say my thanks from a technical level, and now I'm going to pass on to my colleague, Catherine, who is going to formally wrap up the session. So the floor is yours, Catherine. Thanks.
Thank you, Gabby. And thank you, Adelina. Yeah, thank you for your passionate closing address there for that panel session. And it's not just words that we're saying, it's really actions. And we can see that, you know, from you as well. And when you talk about the time is now, our Secretary General does say that a lot, because the pandemic is not over. So there's a lot of these recommendations that have come out of the report that can be put into practice now. And thank you really, Adelina, and all the panelists and the technical collaborators for your comments today. And yeah, we won't end it here. So we want to continue, and from IFRC side, we're very committed to continuing our work and supporting governments where needed. We're here for that. So yeah, so I want to sort of encourage again as well to not delay, I guess, with some of the recommendations, but really to start looking at them now. It's not just about preparing for the future, but it's about having an impact with the current pandemic, and we can do that. So I believe that will be follow-up work in the coming months on guidance, document coming out of this, and we'll be in touch with everybody that has joined this launch today. So apologies that we ran over time, and yeah, thanks to everybody again for the great discussions, and thanks for joining us.
Thank you. Bye-bye.
Thank you, everyone. Thank you, Adelina. Thank you, Catherine, Gabby, Ben, Admini, Hannah. Thanks, everybody.
Thank you, everyone.